So, Michael and Eric, do you know who built this wall?
No.
No.
You don't know, eh?
Not really.
Well, to be frank, lots of people don't know, but the people who built this wall lived over 120 years ago. And they were people who were in a mental institution called 999 Queen Street West, the Toronto Psychiatric, well, it was actually the insane asylum at that time, the Asylum for the Insane Toronto, and they were people who were considered mentally disturbed. It would be really a lot of work, eh?
Yeah.
And the people who built it were all people who were asylum inmates, people in the Toronto Insane Asylum. And they were supposed to have not been able to build much, but look at this.
Did they get paid for it?
That's an excellent question. They didn't get a dime. They didn't get a penny. They didn't get any pay at all.
That's mean.
That's very mean.
Yes, it's very mean. You're absolutely right. So, for example, the people who oversaw the building of this wall had a responsibility to make sure that the patients who built it were treated right. What credit would you have given to the people who built a wall like this?
Write their names in the stone, you know, better food in the asylum, a better asylum, better doctors and stuff, yeah.
Yes, whenever we go by this old wall, we always remember who built it, eh?
Yeah.
And this wall, Eric and Michael, is a symbol of all the patients who lived and died and worked in this building for many years. It's a symbol. Well, you know, we can use this wall too to fight prejudice today by showing how people who worked so hard didn't get paid in the past, but people who have a psychiatric history today deserve to get paid good money for their work, don't they?
Yeah. Just because they have a mental disease doesn't mean they should not get paid.
Have attitudes changed towards people who built this wall? Well, over the past 100 years. I would say, well, while we're talking about it more openly, there's still lots of prejudice out there.
I would say, yeah, it's like maybe on cartoons and stuff, maybe like people are just making fun of them because they're different.
Hi everybody, we're in the Mad Pride Parade, and this is me and Michael. Today's Saturday the 14th.
Mad Pride has been happening for well over a decade.
Madness is the aloofness of society.
Who's gonna tell us take a pill?
Nobody!
Who's gonna tell us don't speak out?
Nobody!
Who's gonna tell us never shout?
Nobody!
Who's gonna tell us we can't be?
Nobody!
Who's gonna tell us what we see?
Nobody!
Who's gonna tell us to stay back?
Nobody!
Who's gonna tell us what we lack?
Nobody!
Nobody!
On July 14th, 2007.
What do you think about madness?
I think people should be included everywhere. It shouldn't be a label.
Mad folks from across the globe are coming together to celebrate.
What are we going to do about labels?
Get rid of them.
You know Japan has already gotten rid of labels.
I did not know that.
The whole country of Japan has no more labels.
Wow, that's really good.
An ever-growing movement and community on International Mad Pride Day. Celebrations are taking place across North America, Europe, and Africa.
I worked with crazies with despair. Ask for a quarter you can spare. Turn the page to reality. It's all what it's gonna be. Face the world.
We proclaim July 14th, 2007,
Mad Pride Day!
Now it's my great pleasure to introduce Sherry DeNovo, the MPP. Who's mad today?
Okay.
Okay, I'll tell you some of the things I'm mad about. I'm mad that we don't have decent housing. Yes, who's mad about that? I'm mad that we don't have a $10 an hour minimum wage yet. Who's mad about that? I'm mad that we haven't had a decent increase in ODSP rates. I'm mad about that. Who's mad about that? I'm mad that we've got increasing privatization of our healthcare system and that meds aren't covered. Who's mad about that?
Please join me in welcoming our very handsome City Councillor, Gord Park.
Who's feeling proud of themselves today? Look at all these beautiful faces around here in the crowd today. Every one of them different, every one of them unique, every one of them special, every one of them a human being. It's such a joy to be here with you. Happy Mad Pride.
Please join me in welcoming MP Peggy Nash.
Thanks, Peggy. It's a pleasure to be here today. Some people say you have to be mad to go into politics, so I feel very at home here today. Who is mad here? Very proud to be here in support of Mad Pride Day.
Today's July 14th Mad Pride Day is also another day. Does anybody know what that is today? Bastille Day. Okay, it's very important to understand because we're talking about in France in the fight for independence, one of the most oppressive, politically oppressive prisons in history, right? Biggest, okay, was repressing the resistance. You know what happened though on July 14th on that critical day? They stormed the Bastille. They opened the gates, let all the prisoners out, all the political prisoners, all the psychiatric survivors, everybody who was challenging the system, okay? So I ask you today, we're not looking to storm the Bastille. We're looking to storm the streets of Toronto. Just like other places in the world right now on this day. In England, they're doing a bed push from Bristol to Bath. They're storming the highways of England. In Ghana, they're storming the streets in Ghana. In Buffalo, New York. In where else they go? Brussels, Belgium. Everybody is storming the streets because that's where the issues are. Okay, that's where the change needs to happen. So that's what we're going to do today. We're going to storm the streets of Toronto. Let's hear, let's storm it.
All we have to do is to go and explore on the streets and dig down deep to find the goal, the strengths they have, the abilities they have, and to focus on it rather than their illnesses.
It's ridiculous. I mean, the way we look at economies is patently absurd, and not only that, unethical. I think the question when you ask about economies is whose economy are we speaking about? You know, I've led this charge in this fight for the $10 minimum wage. We talk about a minimum wage. What do we never talk about a maximum wage, you know? Above which is it unethical to make? I mean, is it really necessary for one person to make $15 million a year? And if they are making that, well, then shouldn't they pay a little bit more, you know, to help those people at the bottom of the echelon?
Dollar, quarter, nickel, dime, $100 bill is fine. Dollar, quarter, nickel, dime, $100 bill is fine. Dollar, quarter, nickel, dime, $100 bill is fine.
What I'd like to know is, why is mental health an industry? Shouldn't it be about wellness? Shouldn't it be about people getting better, getting over some malady or some affliction or some state of affairs? Why is it a big industrial, millions and millions of dollars being spent and nobody's actually getting any of the money?
Dollar, quarter, nickel, dime, $100